What if everyone who cares about healthy communities is already doing public health? They just don't know it yet. My guests make that case, and they're not just stopping there. Tune in to hear how a century-old association is reimagining its future, why plain language is the key to growing the field, and what a statewide conference has to do with it all. You're listening to the PHEC podcast, episode 446. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations, community health foundations as well. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to the community partners, as well as the broader communities they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building, just depends upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. On this episode, I'm joined by two guests. I'm excited about this episode because we're going to be talking about my home state of South Carolina. Let me formally introduce both of my guests to you, and then I'll connect our conversation. For more than 25 years, Keisha Long has been a force in environmental health, helping communities across South Carolina understand, protect, and advocate for the places they call home. After retiring as a program manager in the Office of Environmental Affairs at the South Carolina Department of Environmental Services, she didn't slow down. She just shifted gears. Today, Keisha continues to be a champion for vulnerable communities, helping them build capacity, access resources, and form powerful partnerships that move real change forward. She currently serves as the president-elect of the South Carolina Public Health Association and leads the SCPHA Smart Surfaces Initiative, which is a project focused on climate resilient solutions for healthier neighborhoods. Jessica Seel currently serves as executive director of the South Carolina Public Health Association and co-president of Side by Side Strategies. She leads strategic efforts to improve public health, mental health, and substance use outcomes through cross-sector collaboration, data-informed planning, and sustainable community engagement. Jessica is known for her ability to convene and mobilize partners and maintains a strong network of collaborators across public health, behavioral health, and rural development sectors statewide. She has supported the development of multiple behavioral health coalitions across South Carolina, helping communities identify local needs, strengthen partnerships, and implement responsive community-based solutions. Let's connect my conversation with Keisha and Jessica right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. I'm very excited for this conversation and to introduce my guests. This is a very cozy hometown type of a conversation episode for me because, as you're going to find out in just a moment, these are folks that are very local to me, and I'm very excited about some of the stuff we're going to be talking about. So I have two guests joining me. I have Keisha Long and Jessica Seel. And I am just going to have them take a moment and say hello and introduce themselves. So both of you, welcome to the podcast. It's great to have you here. I'm going to start with you, Keisha, because you're right in front of me on my screen with Cordo and video. You're right here to my left. So Keisha, please just take a moment to introduce yourself.
Hi, yes. Thank you for having me. I'm Keisha Long. I am the president-elect of the South Carolina Public Health Association. I am a retired 27-year veteran of state government. I was in the Department of Environmental Services. Formerly, it was DHEC, so it was a combined public health and environmental health agency.
Thank you. Thank you. It's your turn, Jessica.
All right. I'm Jessica Seel. I am the brand spanking new executive director of the South Carolina Public Health Association. I've spent my entire career, quite frankly, in some facet of healthcare. I've spent about the last 8 years in rural health in South Carolina, specifically behavioral health. And so very excited to be here. And this was one of the first things I got scheduled when I took on this role.
Yeah, that's exciting. We're kind of waiting for you, actually. So this is really, really exciting. Yes, if you've listened to this podcast for a while, I've mentioned my background. I worked in state government here in South Carolina for almost 7 years. So I went from healthcare to working for the state before moving into commercial industry and then starting consulting. So different hats across my career, but it's really nice to have both of you here for this conversation. This is also leading up to pretty soon, just at the time that this podcast episode is released, it will just be a few weeks away from the South Carolina Public Health Association conference. So we're going to talk a little bit more about that in a few minutes. And if you happen to be listening to it after the conference, it's fine. You can put it on your calendar for next year. But I would love to start off the conversation the way that I do with all of my episodes. It's one of my favorite questions to ask. Before we dive into what you're doing right now and the conversation about the conference, I'd love to learn about your journey. Like, how did you get here? And you both have really rich careers and talked about multiple years in state government and different work that you've done. So, starting with you, Keisha, my question is, like, when did you first hear about or learn about public health?
That is kind of a funny story to me. I was at Clemson my senior year. I had a roommate who was majoring in public health undergrad. I remember asking her, "So what is that, like nursing?" And I was in civil engineering at the time and not even public health, environmental health. A little bit. I did want to focus on environmental issues, but I had no clue. I don't even remember what she said. It didn't click. But I did get the job at DHEC in environmental health and specifically the Superfund program. So that's a hazardous waste cleanup program, specifically working on projects and facilities that have been abandoned by their owners. So there's no real owner typically, and the cleanup is on the taxpayer's dime. Now, the way it is set up, the law is set up, if you are to say Exxon, and Exxon buys out companies, if you buy a company without doing due diligence, then you become the responsible party. So a lot of the different projects I had actually did have a funder, not because they caused the contamination, but they had the misfortune of buying it. And I like to actually explain what I did as a engineer and site manager with a picture that I have, which actually is a cartoon that shows the different potential contaminated sites. There's a landfill that's on fire. There's a old facility with drums stacked to the sky, and the grass is dead, and there are no trees. And I will point to this picture and say, this is what I do. I am the supervisor to make sure that these places are clean so they're not hazardous to people or the environment.
Yeah.
So I did that for 21 years. And then I moved into a more community oriented job. I was the environmental justice coordinator for 6 years. at DHEC/DES. And I had opportunity to work more closely with communities and their concerns, and also as an interpreter for these environmental issues. But if you're not in that world, you're not really thinking about it that deeply. So I really enjoyed that. I met a lot of different people who are really advocates and passionate about their communities and want everyone to live their best life in a healthy environment. So that's my career. And then I joined South Carolina Public Health Association about 5 years ago as the environmental health section chair. And then I've moved up to different roles.
So the seed was planted in undergrad, even though her response didn't make sense, and we're going to definitely come back to that whole thing.
Okay.
But but I think it's interesting because I often will say that we know that public health is broad, it overlaps with many fields, but I personally think it's like a superpower when you have somebody who comes from a different background. I say different, like not straight public health, undergrad, grad, and then come and partners and comes into public health with that perspective. So you're, as a civil engineer, into public health, environmental side. I mean, that's just perfect. And that brings such a strength and a very strong perspective. It's a superpower. I like it. What about you, Jessica? When did you first learn about public health or think about it as a
Well,
career?
I love this because Keisha and I, what we're doing is public health, both of us, but they couldn't be more different. So it's super broad, right? People think it fits in one box or the other. It's not. My experience was being a young person, getting my first job in a physician's practice. No experience in healthcare whatsoever. I had family that was in healthcare. I actually wanted to be a teacher for no real reason. I'm not sure why. When I was young, I went to undergrad and experienced a tragedy in my youth with my father related to behavioral health and really took my whole career in a different direction. Really jobs in the beginning, but I really grew a love for healthcare and patients and helping people and just fascinated by the whole healthcare system. Fast forward, I was an adult student, went back to school in my mid 30s and got a degree in social work, fed from my experience in behavioral health with my family, and then decided, why not go to graduate school? Public health looks interesting. It looks a little bit like social work, a little bit like healthcare. I did business development in healthcare, so I knew how to engage with communities and ended up getting my degree in public health, my master's in health promotion, education, and behavior. And it really was a broad degree that kind of took every bit of my interest and experience and rolled it all into one. I graduated from the Arnold School, a proud University of South Carolina graduate, and Columbia College from undergrad, so right here in my hometown, and had a phenomenal experience with that program. I can't speak enough to how they really helped guide me. Even as an adult, I had no idea where I wanted to go because public health really is so broad in so many different areas. And so I landed in rural healthcare. I love the underserved population. I always love our rural communities in South Carolina. They're special. And met a lot of these folks in the Public Health Association, was really interested in getting more involved. And I have partnered with a lot of these folks in my job. And this year I decided to take on this role and also doing some consulting because I didn't want to leave my communities and the behavioral health side of things. So that's how I got here. Not a straight line, but I think that's important for folks to hear too, is go for your dreams no matter what age or what barriers are put in front of you.
I agree. I like your perspective. And I'm chuckling because people listening may not catch this. But here in South Carolina, when Jessica started out saying how different Keisha are, but the same. But here in South Carolina, when you have someone that goes to USC and someone that goes to Clemson.
Well, I didn't mean that, but hey.
Instant rivalry right there. So I think I have to point that out. But yeah, thank you both for those introductions. I can already see really strength of how that partnership with your two roles with the association. I'm going to ask, and either one of you can respond here, but could you talk a little bit about the South Carolina Public Health Association? Because I have talked multiple times about the American Public Health Association on this podcast over years. I jokingly, before we started recording, I said a lot of people probably still think I live in Florida because I've done a lot of work with the Florida Public Health Association. But I know each state has their own, it's part of like the affiliates. But what is unique to or special or what stands out about the South Carolina Public Health Association, if either one of you would like to share that?
So for me, South Carolina Public Health Association initially was an opportunity to engage more directly with people who are focused more on public health, or that's their job title, and outside of environmental health, where we can get siloed even if we're at the same agency. So it was an opportunity to engage either socially or through conferences with people who work in public health. And then I think unique to SCPHA, we were founded in 1921. A lot of the people who developed SCPHA also were heavily involved in healthcare in the state of South Carolina. You see their names on buildings and that type of thing. So it's a deep history in South Carolina, and I think that's something that's unique to us.
What about you, Jessica?
SCPHA is from Keisha mentions the historical perspective, which is super important. I see also a future perspective. I see it as being an association, a platform to, like Keisha got interested in public health. I was interested in public health a little bit older, but getting young people more interested in it, planning for what public health looks like in the future is super exciting to me. When I went back to school as an adult, I was just fascinated by all the young people in that program and their perspective that was different than mine on things. And we have this initiative for young professionals that they're really kicking off and have since last year, I think, Keisha, correct? But
Right.
a networking opportunity. I mean, how often do you get to be in an association that welcomes varying perspectives, but also different ages in a field and really provides that mentorship and a place for them to network and learn from each other? I think that is what is special about this, is really like preparing the future and changing the narrative around public health, really for our communities, our state leaders, and being able to be a part of that and be a legacy to that is really, I think, amazing. And listen, 100 years, how many associations do you know that have hung on through everything that public health has been through for 100 years? So excited to see 100 more years and what that looks like then. I won't see it, but I don't think so. That'd be some great public health right there.
Right, exactly.
You raised a really, really good point. It's a perfect segue into some things I want to chat about. I also I put a lot of my energy into the future of public health, and that legacy piece is very important to me. For me, it's like, what can I do right now that will pave the way for this next generation of public health leaders that they can, if I crack the surface and then someone else can come and make the crack a little bit bigger and the impact is generational. But I just think a lot about supporting and encouraging and being resourceful to this next generation of public health leaders because they definitely have a lot to do. And I think specifically when I think about South Carolina, I'm encouraged more about the change that I'm starting to see and shift and what this next generation can do. So maybe as we think about, and we talked a little bit about this before hitting record, but the audience is used to hearing me talk about this. Public health in plain language. How are we communicating that? And I know I'm jumping a little bit from what we had planned to talk about next, but I think it will tie in quite nicely. I think that it's really important that we put the effort into being better storytellers, connecting the dots for people, helping, whether it's this newer generation of public health leaders coming in to arm them with, I guess, maybe the confidence and the freedom to express and explain public health in plain language. Because sometimes when I work with students and I say that, they get excited about wanting to, but there's this hesitation because they feel like it's very hard to let go of the textbook definition that they've memorized. But really, the freedom just put in your own words and explain it and give an example that's relatable in real life. So when it comes to communicating public health in plain language, How do you feel about that? How does that get incorporated to the conference or just the association in general and just the work that you do? I'm going to start with you, Jessica, because I know you have some things to say about this.
Yeah, that's a big problem. Whenever I did a little bit of talking to some partners that I have and asking them about what is public health to you. I was at a conference around behavioral health and I heard multiple times, we are public health, and folks don't act like we are. And so it just occurred to me now when I'm talking to people, I say, if you are living and breathing, you are touched by public health. Public health is not just doctors and hospitals. As a matter of fact, that's healthcare in general. Public health, think about what keeps you healthy. Public health is, to Keisha's point, a clean, healthy environment. Having, like you said, Dr. Huntley, sidewalks in your community, having access to fresh fruits and vegetables, having strong community support, having good providers, of course, having transportation, jobs. Those are all really everything. All of the things in our environment overall lead to healthy people, healthy lives, healthy families, healthy communities. And I think that we've been bogged down recently when our profession has been a little bit politicized by certain topics. And certainly all of those things are public health, but I want to get back to the core of it. It's just being healthy human beings. And I think that when we think about growing our association, the sky's the limit because there's so many different areas to pull in from that can come together and create a healthy South Carolina. And that's kind of my vision for it. And really speaking at the terms that even a child in elementary school could understand without using all the nomenclature that we use sometimes like that in public health, and really getting back to the basics is super important.
I'm cheering inside because 100% agree with everything you just said. That really touches my heart, even down to like the example of the children. I mean, it's important. Like they understand so many professions. They understand a police officer, a teacher, a doc. They need to understand public health at a very young
That's right.
age.
And all those people are public health, right? A good education is
Yeah.
health. The safety is health. I mean, I really think we have an opportunity to reframe what public health is and elevate it so that it's respected again.
Keisha, you going to add to that?
Something that whenever I did any talks or in front of groups, I would ask if they brushed their teeth or flushed the toilet today. If you did, then you've been impacted by public health
Love
Yeah.
that.
and environmental health.
Yeah.
It's a eye-opening statement. There are so many people involved in making sure that the water that comes out of your tap is clean and not hazardous. The same to make sure that the waste goes to proper facilities and is cleaned. So, yes, public health is broad. We have people in different spheres who focus on epidemiology or environmental health or behavioral health, but it is a community wide system to ensure that everyone is healthy and in a healthy environment. At least that's the goal.
I often think about the opportunities. Our state is pretty much the whole state is a rural state, right? There's so many opportunities for us to even lean into explaining public health through that lens of rural health and using examples that people here are going to easily understand. For example, if we talked about septic systems, that would be a very common conversation because most of the homes here are on septic systems as opposed to like in urban areas, right? They may not really know what that means. So farming conditions and contamination, like why you really shouldn't have the pigs right next to where you're growing your tomatoes. But my farming examples is because my pastime is like homesteading ideas. So that's where I will drift away into things about that.
Easy.
I have a whole lot of those ideas fresh on my head in my mind. So, but it would be easy, right? Easy, air quotes, easy for us to lean into those kinds of examples in an area that's already mostly rural because people are good. It's very relatable to almost everyone in the area. So like picking some place to start that is going to be, more broadly accepted across your community is to me a good move.
Right. And the personal stories, absolutely. like you were saying about your homesteading, and friend who was part of DHEC, and she had to get a new well drilled, and the guy was, I don't know where he's from, but he wanted to drill her new well in her septic tile field. It's like, no, no. But since she was in environmental, she understood, the implications of that. But if you are not really understanding how things are recycled,
Yeah.
$4,000 well could go right in there and not be a good one.
So many good things to think about, so many good ways that we could, taking specifically here, South Carolina, but someone listening who's not in South Carolina, think about what's common to your area or the people that you talk to or the people you engage with and, use those stories, make it simple and plain and give yourself permission to do that. We don't need these super jargony explanations. If people are like the same example for you, Keisha, when you were an undergrad and you were curious, someone's curious and then you give them an answer they don't understand, they walk away like, I don't get it. And they just dismiss it. Missed opportunity. We have to catch ourselves. So from that, leading into the conference, I want to hear more about the conference, like the plan. I mean, is there a theme? Just tell me more. I guess, Keisha, we'll start with you.
Great. Yes. So we do have a theme. The theme is typically presented by the president, who's Lummi Young, and his theme is exploring horizons, innovating for the future of public health. We are really focusing on collaborative partnerships, a very government term, but we have some really good keynote speakers. I believe we have Jim Rex, who was Education Secretary, Superintendent of Education for South Carolina. He's the 16th one. So he was in office in early 2000s. He's going to be speaking on Hope Squads, which is a peer-to-peer mentorship program in schools to help with combating suicides, bullying, and those types of things. And then we have the president of APHA, Nandi Marshall, Dr. Nandi Marshall. She's coming in to speak to us on Tuesday, give her keynote address. So looking forward to what she has to say. And then we have a panel that will be moderated by you, Dr. Huntley. And we're looking forward to that. We have Dr. Nandi Marshall will be on the panel, as well as Queen Quet, who's the head of state for the Gullah Geechee Nation and also basically international superstar. And then the Catawba Nation representatives. So those are the big headlining events or speeches that we're anticipating. But throughout, we have other things going on. We have wellness sessions like Tai Chi and yoga, and we're going to be making salt scrubs. Really looking forward to that, and chunky blankets with your hands. I'm really looking forward to that. And some pet therapy, including a therapeutic rabbit, named Violet. And then we will have concurrent sessions from those speakers who have put in abstracts and want to present their research or their professional work. We'll have student poster sessions, as well as speaking of youth, a Young Professional Network will have a session, 2-hour session, where they're going to be doing an interactive workshop, have icebreakers, do a photo booth. I know this is not for me, but I'm going to see if I can peek my head in because it sounds like a lot of fun that they're setting up here for March. We'll have a ball, President's Ball, and meet and greet. So it's a lot of different things that people can come learn and socialize and network and relax, because it's not all about work. I mean, that's how we burn ourselves out if we don't take time to take care of ourselves.
I'm excited about that because I do know Nandi Marshall, and she is somewhere on our plans for an episode here. Each year we try to bring in the APHA president for an episode. And I'm excited about all of the things you just mentioned, and I hadn't looked at all the details, so it's kind of fresh for me to hear like, oh, this is going to be so much fun.
Right.
So you got me to agree. I agreed. Yes, I'm going to moderate. I'm ready to show up. And I hadn't even looked at all the other details,
Right.
but I was 100% on board. So this is like a surprise for me. So a nice little surprise. I'm excited to participate, to support the conference, the people, just the fact that it's right here in Columbia. I'm also excited about. And in the past, I think I've always had some sort of a conflict with my schedule, and then also it's been in Myrtle Beach, which always made it a little bit hard to get to. Although I travel a lot, so it's not really the location, but something about the timing has always been a bit off. So I'm excited to participate this year. I do wonder about kind of in general, who attends this conference? That's kind of the question. Is it a mixture of students, like government? Is it, like who shows up to the conference usually?
We in the past have had a heavy presence from DHEC, now DPH, and a little bit of DES, and also the university. So USC, MUSC, Lander University, Clemson University, academics essentially, and a little bit of consulting. But we're trying to broaden that sphere and have more groups who may not traditionally think of themselves as public health, but they are public health, to attend the conference this year. And one of the goals or the reason why we have it in Columbia is to tap into more of the state agencies that may not traditionally have come, like mental health or disability, or other groups who have their main offices in Columbia, but didn't want to travel to Myrtle Beach or couldn't justify the travel to Myrtle Beach. But it's going to be right in the vista at the convention center, where it's a 3-minute drive from your office. So it'll be an easier lift.
That's wonderful. Jessica, what's your vision for this then?
I think what we were talking about earlier, the broad definition of public health, is number one. Keisha was talking about this year looking at collaborative partnerships. That is my love language. It takes a village to do this work. And, what I'd like to see is all of these different spokes in the wheel coming together, having diverse speakers and having the networking piece, learning from each other, hearing someone from environmental health talking to a first responder, or, all of these different folks that all don't realize how closely they work together, and building an alliance and an infrastructure for public health in South Carolina, and really having the Public Health Association being that conduit to that. Using our Public Health Association as a voice to policymakers too, having some different viewpoints from not just geographically, but from different sectors of public health. I want us to be seen as such a valuable organization that people will find a way to get involved and to attend the conference because they don't want to miss it. And I've seen conferences be that way. I think with budget cuts and, these days, we're all overly busy. There's no disconnection. So to Keisha's point, this is unique because we have all those things, but we also have a little bit of self-care, which I'm a huge advocate for, public health, right? You wouldn't believe how many people you can get to come to something if you say pet therapy. I'm one of those people.
Yeah, I literally wrote that down.
See, a rabbit. I mean, even bigger, chunky blankets. I mean, this is what. Have a massage therapist there, and hands down, we'll be there. I think that is such a huge part of it. We're going to work really, really hard, but we have to take care of ourselves and advocating for that. And this conference and this association speaks directly to that.
Yeah. Well, I am genuinely excited about the conference. And not only the conference, but really getting involved with the South Carolina Public Health Association beyond the conference in whatever way that I can be supportive. So putting it out here on the episode now. So that means that you call on me if there's something that I can do, if there's a way that I can support. Everybody's hearing me say this. So reach out to me. This is home for me. So I have a vested interest in what happens with this association in my state. So Thank you both for taking time and being here today. I have one final question just as we wrap up. Now, there will be a show notes page with links to connect with you and people who are interested in registering, going to the conference if there's time. If you're listening to this at the time that it's being released and before the conference time, you'll have access to all of that. As we begin to leave, I just want to know if there's like a bit of advice, just we're in challenging times in public health. So is there a bit of advice, a little tip, a word of encouragement that you can leave with people that are listening to this episode, doing this work in public health, regardless of whatever their specialty area is? Is there any bit that you can share with our listeners as we wrap up? I'll start with you, Keisha.
The key really is to lean on your relationships that you've developed and the trust that you've built over the years. If one, and this is personal experience, one avenue has been blocked completely or the bridge has been blown up, but there's a side path that opens up or has opened up, and I can continue to do the work that is meaningful for me. So even though things have been eliminated or killed or stopped, the work hasn't stopped. And in fact, it has opened up opportunities to partner with other groups.
Yeah. Thank you for that. What about you, Jessica?
This is a movement right now. We're in challenging times, and while some get scared of that, I get excited because that means that there's the opportunity to do something really, really great and be remembered for it. And I think that's what public health is on the verge of right now in South Carolina. To those folks listening, whether you work at a state agency, whether you work at a health system, whether you work in your community, no matter where you work, if you're interested in changing public health for the state of South Carolina and want to leave your mark and leave this state better than you found it, jump on board with us. Join the association. Reach out to me, reach out to Keisha, and we want to hear your voice and we want to have you at the table. All are welcome.
Oh, it's powerful. Thank you both. I genuinely appreciate your time for sharing the details and, representing my home state to my entire podcast audience. This has been fantastic. And I look forward to seeing you in person in just a little while at the conference. I guess I'll have to do like a recap episode and share like what happened and takeaways. Thank you both. I really appreciate it. And we will definitely be in touch.
Thank you.
Fantastic. Thank you for the opportunity. And it was fun. Yes.
I really hope you enjoyed that conversation as much as we did. Public health is broader than most people realize, and that's exactly the point. When a civil engineer and a social worker turned public health advocates sit at the same table, something powerful happens. The field expands. This episode is a reminder that your background is an asset and that building a healthier community requires every voice in the room. Whether you're just starting out or decades into the work, there's a place for you at this table and it's worth showing up for. Remember that if you're listening to this episode close to the time that we actually released it, the South Carolina Public Health Association's conference is coming up in mid-March of 2026, and I'd love to see you there. You can find registration links in the episode description as well as on the show notes page. I do encourage you to connect with Keisha and Jessica and learn more about the great work that they're doing in South Carolina. You can find links to connect with them and also register for the conference on the show notes page. The show notes page for this episode, which is episode 446, can be found at phecpodcast.com. Once you're there, just navigate to episode 446 to find the show notes. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.